The Republican governor of Nevada just put his middle finger up to the people of Nevada. Governor Brian Sandoval waited until the last day he could, which was Friday, to veto a measure that would have offered a state-sponsored health insurance option to all residents, regardless of income. If he hadn't signed it or vetoed it by midnight, it would have become law. If the Republican governor had signed it, Nevada would have become the first state to attempt a Medicaid for all approach to health insurance. It also would have placed Nevada among the ranks of states that are looking for ways to solidify health insurance options for populations that will be at risk if Congress and President Donald Trump gut the Affordable Care Act. In his veto message, Sandoval praised the sponsor of the bill for creativity in attempting to design a healthcare option for the state's 2.9 million people, but he ultimately reasoned that there were too many unanswered questions about how the program would work. He wrote that the legislation was an undeveloped remedy to an undefined problem, and that it didn't get proper scrutiny before it was passed in a short time frame. The bill's sponsor, Democratic Assemblyman Mike Sprinkle, hilarious name, acknowledged that the proposal it would have required a lot of work if it had become law. That's why he put an implementation date of January 2019 in the bill. Okay, so right off the bat, the only argument that the governor made is wrong. He goes, oh yeah, too many unanswered questions. We got to iron out the details of this bill, and there's not enough there for me to be able to sign this for the people of Nevada, yeah. But I just told you, the implementation date was January 2019. So all the problems that would have came about and all the questions that needed to be answered, you would have been able to answer them because you have plenty of time before the actual implementation of this bill. Now also, let me be clear about something. They called it a Medicaid for all program here. That's not the most accurate description. What it is, in reality, is a public option at the state level for everybody in Nevada. So, in other words, they go on the Obamacare exchange, and when they're shopping for their health insurance, there would be the option of a Nevada public option where you can opt to buy into that. So it's a little misleading to call it Medicaid for all or Medicare for all. It's basically a state-level public option. So this is like the least that can be done in terms of the acceptable reforms when it comes to healthcare and health insurance. Like, public option is basically watered down Medicare for all. That's what that is. And we're not even talking about a public option here at a federal level. We're just talking about in the state of Nevada. And the governor's like, no, come on, there's too many unanswered questions. No, you know where there are unanswered questions? In the system we have right now. People keep losing their health insurance. People keep going bankrupt as a result of medical bills. Medicaid gets gutted every 12 seconds by the Republicans. They want to gut it right now, $880 billion worth. So you want to know where there are unanswered questions? In the system we currently have, in the system run by rapacious for-profit health insurance companies. Guys, there is a simple incentive structure problem when you talk about private health insurance companies. How do they make more money? They make more money by denying more care. So you pay into them every month, and then when something happens, they go, okay, now we know that you're sick and you need us to pay for it, but here's what we're going to have you do. Submit a claim. Submit a claim, and even if we approve the claim, you have to pay the first, $3,000. Why the fuck am I paying you every month? Why am I paying you every month? If when something happens, you pay me $3,000. The fuck is that shit? What is that? And submit a claim. Go ask somebody who lives under a single-payer system. How's their claim going? They don't need to fucking submit a claim. You're sick. You get help. It is covered by the taxpayers. That's it. Everybody go home and have a sandwich. That's the way it works. That's the way it should work. That's the way it's supposed to work. But here in the U.S., we have a horrible system where the rapacious for-profit health insurance companies try to get every penny out of you they possibly can and try to wiggle out of care by any means necessary. So we've covered the stories. Pre-Obamacare, there was one woman who had cancer. And so she needed her health insurance to cover her expenses. They go, we're not going to do it. She's like, why? They say, well, you didn't tell us about your pre-existing condition. She goes, what do you mean pre-existing condition? They go, yeah, your pre-existing condition, your skin condition. He goes, what are you talking about? I had acne when I was like a teen. They go, oh, okay, but you say it's acne. We say it's cancerous skin lesions. Therefore, we're not going to cover your treatment for your cancer today. Nice random noise at a weird time because I hit the table. That's the system we're going to live under? And the Nevada governor is going to tell you? Yeah, you know, it's too many unanswered questions with this healthcare system that would be a slight improvement over what we have now. What a joke, man. Somebody dig into Governor Brian Sandoval's funding. Because I'd be stunned if there wasn't some private health insurance companies giving him money. Or somebody, or Big Pharma, or whatever. There's some creepiness going on there. Because if it's not corruption, then he's just an idiot. It's one or the other. Either you're corrupt and you're doing it to please your donors, or you're an idiot. You tell me which one it is. By the way, Brian Sandoval, that name might sound vaguely familiar to you. It's because President Obama was considering appointing this guy as a Supreme Court justice. Neoliberalism is a hell of a drug, huh? Because he's, I got to appease the Republicans, so I got to get a moderate Republican who I'll appoint to the Supreme Court. Well, this is what this guy does. He vetoes a public option bill in Nevada. It already got through. All he had to do was nothing, and it would have went into effect. He said no. So how many people did he screw over out of getting health care as a result of this? A lot. This is absolutely disgusting. The Republicans are just, the Republican politicians are just your enemy on the issue of health care. They're your enemy. Because everything they want to do makes the system worse. How crazy is that? Everything they want to, nothing they're in favor of fixes any problem we have. It all just makes it a bigger giveaway to the private health insurance companies. And the Democrats, you know, most of them just want to defend Obamacare, which was a 25% step in the right direction, but you're only going a quarter of the way to what you have to really do, which is Medicare for all. So we're in a system that's so beholden to big money and corporations that very few politicians are for what we know the answer is based on all the evidence. Every other modern nation has one version or another of a single-payer system. They pay less for their health care. Everybody's covered. Medical bankruptcies aren't a thing. But no, we're stuck in this broken system where a governor vetoes a public option, which is already watered down at a state level. It's disgusting, and Brian Sandoval should be absolutely ashamed of himself.